The Wellness Revolution starts now.
Hello, I'm Dr. Steve Hotze, and welcome to Dr. Hotze's Wellness Revolution. I have as my guest on today my colleague, fellow associate here at the physician at the Hotze Health and Wellness Center, Dr. Don Ellsworth. Dr. Ellsworth is a graduate of Vanderbilt University. He then graduated from the South Carolina Medical School in 1986, went on and got a family practice residency certification there, and that was in 1989, graduated from the family practice residency program, and then went into the military for 4 years in the Air Force. And then in 1994, decided that he was going to go into missionary work as a Christian missionary doctor and went to Uzbekistan. So I'm proud to have Dr. Ellsworth with us, and we're going to visit with him about his approach to our guests as they come into the Hotze Health and Wellness Center. Dr. Ellsworth, thanks for joining us today.
Well, thanks for having me.
And thank you for the wonderful care you take of our guests at the Hotze Health and Wellness Center.
Well, it's been a wonderful time. It's been coming up in 19 years.
19 years. So you were trained in a very conventional way in medical school at South Carolina Medical School, and did a family practice residency and went into the Air Force. And that had to be all very conventional type medicine that you were practicing at that time. You went off to Uzbekistan to do missionary work as a physician. Tell us a little bit about that. What did that entail?
Well, what I was trying to do is to help the medical system adopt some of the strengths of our system. And interestingly, as I looked at that, I recognized that we had a very drug-based system that didn't necessarily allow for them to pick it up because these were very expensive drugs. And that really prompted me to try to find more simple, straightforward ways for people to stay healthy in the first place and treat them without as many high-tech maneuvers. As, you know, the expensive drugs we tend to use are not available in many countries. And so in doing that, we actually developed some health curriculum for the school. We wrote a book that was an adaptation of a book that had been written called Where There Is No Doctor, but we modified that and added chapters to it and medication lists, and it became a very useful resource for people. But we included information that did not involve what they had actually included in the original book. For example, we talked about how to use iodine more effectively, to prevent goiters and some thyroid issues, and some natural herbs for addressing things like, depressed mood. There was a wealth of natural herbs in the area. And that got me learning more about natural things because they liked the idea of natural things, and that's what was available. And so I began cataloging what was available. And interestingly, when you go into a pharmacy in that part of the world, they would have on one side traditional drugs, and on the other side, they would have packets of herbs. It was that integrated in their mind. And it really came to a head when my wife, who has been completely healthy, had just had her third child, developed fatigue, and she really was like a different person. She had almost no energy. She was in bed a lot. And at first you think, well, this is going to get better. It's like a flu, or maybe it's mono. And then it turned into months. And we actually wound up coming back to the States. And it turned out that she was meeting all the criteria for what they call chronic fatigue syndrome, and which is just really a description.
Right.
So she had tender lymph nodes, sore throat frequently, couldn't think clearly, get lightheaded, but she was almost bedridden for this better part of a year. And even after all the tests are done and we see multiple doctors in the U.S., there was no clear answer. So it turns out, in God's divine providence, I run across a book called Chronic Fatigue and the Yeast Connection in Chronic Fatigue by William Crook. And this book outlined how when you take antibiotics, which she had for a couple of sinus infections, it can alter your gut and allow yeast to overgrow, and you can get sensitive to foods. And I had never heard of this before, but nothing else had worked, and it didn't sound like it made sense, and we didn't have anything to lose. Everything went away when we applied what Dr. Crook said. So basically, this approach that I had never learned in medical school, and to this day, most people won't hear when they go through medical school, it resolved our problem. But as I looked into this, there are plenty of medical articles on yeast overgrowth, on how it can cause fatigue, how it can even cause changes in the gut that can lead to food sensitivity. But no one teaches this. At least I haven't heard of this being lectured on in medical schools. And I began to realize, gosh, if I missed this,
what else
did I miss? So I started reading more. And then I found the Pan American Allergy Society was having a conference, and it sounded intriguing. And I went there and I heard some fascinating information. And when I was standing in line to meet somebody, he said, well, you need to talk to this man. And it was you, Steve Hotze. And literally your first words to me were bioidentical hormones. You've got to learn about bioidentical hormones. And that's indeed what wound up happening, because you were kind enough to invite me to visit. At that time, we were just talking.
Right.
And you were showing me what you did. And I was looking around and realizing you've put together what I've had in the back of my mind is being needed to take place. I was just segueing back to the United States at that point. And I realized you had put together a program for addressing chronic illnesses in a way that made sense and was working. And basically, it's looking at people like they need to go back to God's original, the way they were made, not looking at them as drug deficient. And that was really one of the paradigms that I came to appreciate. It when we go through medical school, we look at the end of the day, we start looking at people as being drug deficient. Like, what drug do they need to get healthy? As if everybody running around is an antidepressant deficient, or a statin drug deficiency, or having some deficiency of an anti-inflammatory. And you don't realize you're doing this, but at the end of the day, that's the way you start thinking. And now I realize that really we were created to be healthy, and if it was a perfect world, and it's not, if it was a perfect world, we'd stay healthy. But a doctor's job is really to try and do a course correction just to get us back to the way we were designed to be. And that's best done working with natural ingredients.
Well, that's right. My dad told me while I was in medical school, he would repeat to me over and over again. He said, son, remember, God has given the body amazing restorative power. It will heal itself if you just have the right molecules in your body. And he told me, don't poison your patients like all the other doctors do. Do you hear me? And that's what planted the seed in my life back in 1976 when I graduated from med school that ultimately gave birth to the Hotze Health and Wellness Center, was the fact that my dad said, don't poison your patients. And as I went through and saw all the side effects all these drugs were having on many of our guests, and when one of my guests back in the old days when I was on the north side of town came in and I asked her how she was doing, and she had a big smile on her face. She said, Dr. Hotze, ever since I threw away all the drugs you were giving me, I feel like $1 million. And I thought to myself, don't poison your patients. I heard my dad's voice, don't poison your patients like all the other doctors do. So that's how I made my transition. I went and ended up at that same allergy conference you did a few years earlier, and that's where I learned about natural approaches to health. So at the Hotze Health and Wellness Center, why don't we go over very briefly what 8 points we treat, what we do, what are the 8-point treatment regimen that we have for our guests?
Well, we certainly treat airborne allergies, food allergies, and really even some chemical sensitivities now, treating yeast overgrowth, thyroid issues, bioidentical hormone issues, vitamin, mineral deficiencies. And we have a really extensive program for replacing all of those. And as we built out our way of thinking, I look for core imbalances that are going on in the body. And sometimes that's an issue where there's a toxin building up in the body. Sometimes the issue might be that there's a key deficiency of something like, iron deficiency, surprisingly, is more common than people think. And addressing that can make a big difference. But our whole goal is to identify what's out of balance and put back in what's missing. And if something is in the body that doesn't belong, like yeast overgrowth, we're working to get rid of it or calm down the reactions with our allergy program. And what we find is that when the body's in balance, inevitably good things happen. And that's
the amazing restorative power in the body. So people are basically sick because they either have high levels of toxins or low levels of nutrients or the natural hormones. One of those two things is out of balance. So what we try to do here is detoxify, help people detoxify, and let's talk about that, how that's related to our eating program and our vitamin and mineral program on detoxification, and what other things we do for detox.
Well, it depends on what we're trying to detoxify as to which way we go with that. And I didn't specifically mention adrenal fatigue, but the adrenal glands also can be an issue, and addressing that can be important. But the functional medicine model is something that we've adopted. I've adopted more. In fact, I was able to go through the functional medicine certification program with the Institute of Functional Medicine. And some of the core ideas there are to identify the clinical imbalances that occur. And if you think of the body as being, when you look at a tree, if there's something wrong with the leaves, your first thought generally is something's wrong, and it's probably not at the leaf level. It's from the roots, perhaps.
Right.
It's you're thinking more what's behind all this.
Holistically, you're looking
Right.
at the tree as a whole rather than just at the problem.
And in fact, and in the natural realm, I think people tend to be more adept at getting to the root issue than modern medicine has been, because modern medicine has really gotten us, again, looking astray, looking at drugs. And so what we would do is ask questions, get a background information, and often that gives a clue as to where the imbalances may lie. And then we'll do, of course, a good physical exam and do strategic testing. And there's a lot of ways the testing can go. And you want to remember the strengths of the testing and the limitations of it, because one problem, for example, is the reference ranges are wide and you only see what you're measuring. For example, if you're measuring something in the blood, you're only seeing what is actually there. And one mistake we can make in the thyroid realm is thyroid actually doesn't work in the bloodstream, it works in the cell. And people forget that you're not seeing directly how well that's working. So we have a strong emphasis on using history and physical and integrating that with the labs, rather than the basis of medicine that I think most doctors walk away with after their training is they really rely overly on labs and imaging studies to make every decision. So all of those things are useful, but the limitations of those are very much underappreciated, and doctors typically overlook things or overdiagnose things based on that.
When I was in medical school in my first year, I took history and physical, and one of the physicians in a small group said, if you will listen to your patient, they will tell you what their problem is,
Right.
if you will listen. Now, what I have found in many of the guests that we've seen here at the Hotze Health and Wellness Center, they've told their physician what they thought their problem was, and their physician did everything to disprove what they thought their problem was. Like they come in and say, doctor, could I have low thyroid or hypothyroidism? And the doctor would say, why do you think you have low thyroid? Because I've got fatigue, difficulty with weight, I can't think clearly, my joints ache, I've got sluggish bowels, I get recurrent infections, my hair's falling out, I'm puffy and pale. And the doctor would say, that doesn't mean you've got thyroid problems. You've been on the internet too much. They ought to ban all this stuff on the internet. I'll prove to you don't. And they will get a blood test on them, and they'll say, see, your blood test is in the normal range. Now, how do we handle that? And you've heard patients, our guest, we call our patients guests. You've heard our guests come in, thousands of them. You've seen thousands of patients here at the Health and Wellness Center. We've seen over 33,000 guests that we have evaluated and recommended treatment, a natural approach to health. Mm-hmm. By the way, when Dr. Ellsworth mentioned that he had been certified by the Institute of Functional Medicine is alternative. It's called alternative medicine, holistic medicine, natural approaches to health. All basically mean the same thing. And it's those physicians like ourselves here at the Hotze Health and Wellness Center and our other providers who don't rely on pharmaceutical drugs as a solutions to people problem. We don't try to mask symptoms. We want to find out what the underlying cause is. So as I just got through asking you, tell us about some of the guests you've seen here when they come in and they've told you, like a guest told me, like, I went to my doctor and told him I had all these problems, and he just told me I didn't, and I know I've got them. I mean, how tell us about the importance of listening to our guests to us.
Well, we see people frequently that have seen many physicians in the past, and usually that I can count on the traditional approaches not having worked, and the
they wouldn't be here
walk through
otherwise.
the doors. And there was a teenage young lady who came in quite depressed, and she had seen doctors for that, and that was not helping her. And what was turned out to be very helpful for her was getting her nutrition improved. Specifically, she was actually low in iron, but that was only something you could pick up if you were measuring the more detailed testing, not just looking at the basic CBC and serum ferritin and serum iron rather. But addressing that, and also her thyroid was off in a significant way. And addressing that made all the difference in the world. And so that she went from having a significantly depressed mood to actually being a happy young lady doing completely fine. And in fact, she was initially homebound because she was doing so poorly, and now she's thriving in a very challenging environment. So you see people literally get their lives back when they make some simple changes. But I think the mistake that we often make is we just superficially look at someone, and since the diagnosis of depression is looked upon by so many doctors as the diagnosis rather than a symptom.
That's an important point. Mm-hmm. Expand on that.
Well, there's the idea that theoretically doctors really dig to figure out why someone has an issue. But the reality is that when the emphasis is on coding for the diagnosis, what you tend to start doing is you get lazy. And the medical world says, whatever depression, well, you're depressed. And while they may be doing a few simple tests to make sure that you don't have an obvious reason for the depression, they really start thinking of the symptom as the disease. And if that's the case, then you look for the pill for the ill, whatever the anti is, the antidepressant in this case. And it becomes an unfortunate thought in doctors' minds that good medicine is giving a drug for a symptom when that's really just symptom management. And that's certainly not where you want to be stopping. That, if such a thing needs to be done, that should be a stopgap while you're determining the root issue.
So what we're talking about is physicians taking symptoms and calling the symptom the diagnosis. Somebody comes in and goes, I'm tired all the time, my head aches, I got sore throat, I'm sick all the time. And they comes back and he says, you've got chronic fatigue syndrome. And they go, oh, good. Thank you. You've got my diagnosis. Your question should be, why do I have chronic fatigue syndrome? Yeah. If you've got recurrent headaches, they might say, you've got migraines. That isn't a diagnosis. That's a symptom. Migraine is a symptom. The headache is a symptom. Why do I have migraines? Mm-hmm. What's causing the problem? Mm-hmm. We always want to get at the underlying cause, and the underlying cause is the diagnosis. The symptom is not the diagnosis.
And sometimes the underlying cause is one or two things, and sometimes it's 10 things. So it's not uncommon for us to not have any one major thing throwing us off, but it's from multiple directions. We're low in their vitamin D, testosterone being low in men. We frequently see men in midlife, and say mid-55, coming in feeling depressed, tired, not sleeping well, not having great drive and motivation, romantic inclinations being off. And I can think of, many men who, when they come in that scenario, the simple things make a big difference. But if you just tried to treat them, say, with testosterone, and you didn't do anything to address, say, their gut health, you don't get very far. So you always have to approach all the issues that are off. And we emphasize that a lot here at the Hotze Health and Wellness Center, that you really want to make sure you're addressing all the core issues. And lifestyle change is always important, and getting enough sleep, eating the right foods. But doing the yeast cleanse, we often find to be foundational. In fact, in the functional medicine world, there's an axiom that you generally want to make sure, first and foremost, that the gut's healthy. Because if you don't have the gut healthy, the rest of the body just won't respond well.
That's a good point. And we have just a minute. You can comment on this. The brain is in the gut. You think that's right or not?
It's been some people have called the gut the second brain. Some people have even quipped, well, the brain may be the second gut. It's so important that the brain is actually has a lot of neurotransmitter activities, but the gut, if you actually look at how many neurotransmitters that the gut makes, it actually outnumbers the brain in some neurotransmitter levels. And so it's actually amazing how connected the two are. In fact, you can see in some issues where there's an inflammatory bowel disease, when there's lesions in the gut, you see lesions in the brain. So they literally are connected. The vagus nerves connect them.
I just read something the other day, and you may be aware of this, but I wasn't, that there's 400 times more melatonin made in the gut than in the pineal gland. And melatonin is your natural sleep hormone, and it has a host of other positive effects on the body. Well, Dr. Ellsworth, this has been a very informative discussion about the way we approach individuals here at the Hotze Health and Wellness Center. We approach each one of our guests as a separate individual. We listen to their underlying problems, and we let them tell us what their problems are, and then we just use our blood work and other studies to kind of corroborate what our initial impression is. And we don't treat strictly on blood tests, but we try to treat based upon the clinical symptoms and figuring out what the underlying cause is. Having seen so many guests over your career, you've got the expertise and know how to do that. So thanks for joining us, and thank you for the great work you do here.
Thank you, Steve.
At Physicians Preference Pharmacy, we believe that prescription drugs are commonly overprescribed, treating symptoms only rather than addressing the underlying condition. These drugs offer a temporary fix, but they don't solve the root cause of the problem. Our approach is not about overloading people with medications that offer only a temporary fix. It is so important to recognize that you do not get sick because you have a low level of pharmaceutical drugs in your blood. You get sick because you are deficient in something or because your body is not in balance. As part of your healthcare team, we work with your doctor to restore that healthy balance. Sometimes this means replacing hormones, vitamins, nutrients, or even antioxidants. So how is this different than traditional treatment? Rather than covering up the symptoms with yet another medication, we work to replenish the body, restoring your health and restoring your wellness.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.